pacemaker. What image comes to mind when you hear this word?
Perhaps a bulky metal contraption visible under someone's skin, wire leads being intricately placed within the heart. Well, my friends, you're thinking in the past. Allow me to introduce my Micra, Medtronic's newest and smallest pacemaker. At less than 2 grams in weight and only the size of a AA battery, it's the smallest pacemaker available, and it lasts for up to 12 years.
This pacemaker is small, leadless, and doesn't require a subcutaneous pocket for implantation. That reduces a lot of the risks associated with a traditional pacemaker. But more on that later. So we get it. It's small, it's leadless, but what else? How does it get in there?
Let me tell you, the procedure is hardly considered invasive. A guide wire is placed into the femoral artery, advanced through the inferior vena cava, through the right atrium, and into the right ventricle. From there, the Micra is loaded onto the guide wire, advanced along the guide wire to the right ventricle, where the prongs are activated and the device becomes implanted within the muscle of the right ventricle near the apex. From there, the guide wire is simply removed and boom, that's it. The pacemaker is good to go.
So you may be thinking, hold on, the heart's natural pacemaker, the sinoatrial node, that's in the right atrium, while this device is in the right ventricle. So how does that work? Well, sometimes signals from the sinoatrial node can't pass from atrium to ventricle. Or perhaps the atrioventricular node itself is dysfunctional. This can cause bradycardia, and when symptoms arise, the Micra truly shines. Its location in the right ventricle allows it to regulate cardiac rhythms and monitor normal ventricular function. Specifically, this can be used in patients experiencing symptomatic bradycardia, perhaps due to atrial node tachyarrhythmia, sinus node dysfunction, or atrioventricular block.
Complications from microinsertion are incredibly rare, which highlights the safety of this new device. As mentioned before, conventional pacemakers are laden with complications. However, with the Micra, this is no longer a problem. In patients at risk of developing severe postoperative infections, such as those receiving dialysis treatment, the creation of a subcutaneous pocket and implantation of a traditional pacemaker can drastically increase the risk of infection. Some patients even experience recurrent postoperative infections. However, with the Micra, no subcutaneous pocket is needed. Thus, the risk of infections is significantly decreased. As for the leads themselves, in a traditional pacemaker, the leads can become dysfunctional, and at worst, they can puncture the heart. In fact, 66% of all lead-related complications of traditional pacemakers were simply due to lead dislodgement.
Now, we're by no means saying that the Micra is perfect, as much as we wish it was. It can only be used in a small subset of populations, and currently its only insertion point is the femoral vein. But as we speak, researchers are looking at the efficacy of the Micra in fragile populations and people at the end of their life. And we can't wait to see where that takes us.
I love my Micra, and you can too. Talk to your doctor today about the Micra.
Coming up next on HGTV is Fixer Upper at 2 a.m. Eastern, 1 a.m. Central.